Hello, I'm Dr. Chris Meletis. I'm a naturopathic physician for the last 33 years here in Oregon. I sit on the advisory committee for MYOS MD. And today we're going to discuss sarcopenia, lean body mass, and the ingredient called Fortetropin. But let's start with a philosophical concept. If I was to ask you, what walked on 4 legs, and then 2 legs, and then 3 legs, the answer, according to the Sphinx in the riddle of the Sphinx, is humankind. So once again, do we really want to walk on 3 legs, or worse yet, 6 legs with a walker? So the question is, what do we do to safeguard ourselves from that unnecessary aging process? There's chronological age and there's biological age, and we want to be youthful with a young biological age, regardless of what our driver's license or birth certificate says. So the concept of sarcopenia is very real, and that's the concept of losing muscle and muscle mass and often muscle strength. And that contributes to both morbidity and mortality across the board. They show that seniors that have the weakest muscles are the most likely to have both morbidity and mortality. But you're saying, hey, I'm not a senior. But the goal is not to become a senior that has that problem. Maybe you're a firefighter. Maybe you're a paramedic. Maybe you're a boxer or a triathlete. Maybe you're just a person that's a very busy mom or dad or a professional and you want to stay well. But once again, if we don't use it, we lose it. But at the same time, with the passage of time and something called epigenetics, diet and lifestyle, we start actually losing muscle. And then one day we wake up and we say, like, oh my gosh, what happened? Well, the concept of use it or lose it is very real. Okay, I sit here like I have for the last 33 years of clinical practice in front of a desk and seeing patients and not moving as much as I want to. Well, I can lose muscle mass and I'm not nearly as strong as I used to be. And in regards, if I had known what I know now and what I'm going to share with you, I would not have allowed myself to become deconditioned, and I would have incorporated Fortetropin many a year ago. But now let's say you're doing great, you're doing a good diet, you're exercising, you're staying fit, but then the injury happened. For me, it started with a double hernia repair back in the beginning of 2020, the COVID era. And I was laid up because of the hernia. Then I had to recuperate from the double hernia surgery, and they said, don't lift, don't do this, don't do that. Well, that's my excuse. I'm going to stick with it. Or maybe you get hospitalized, and as a result, you're laying around, and then you have to, once again, recuperate. Well, these all contribute to loss of muscle. So this is where I incorporate my clinical practice, Fortetropin, to support the body and allow rehabilitation. Now, muscle has a lot to do with a lot of things, but it also produces something called myokines and exerkines. These are hormones. In fact, now we realize the muscle is a hormone organ. And you can see in the blue, there's a correlation between the brain and Alzheimer's, sarcopenia happening, and then ultimately the premature aging. So once again, we say the gut-brain connection. Well, what about the muscle-brain connection? Very, very much tied together. So when we look at Fortetropin, it is an all-natural, raw, fertile egg. So unlike what you get in the store, which is not a fertilized egg, and it's definitely not raw, well, what we want to do here is we want to harness that spark of life that occurs during fertilization and not have it be nullified with a heat or a process. So it's processed in such a way that it's safe to consume clearly, and at the same time, it's delivering the magic sauce, so to speak, the Fortetropin. So Fortetropin and myostatin dysregulation. So as I get heavier, all things being equal, my myostat levels are going to rise. If I go ahead and become deconditioned or injured, my myostatin levels are going to rise. With the passage of time, my myostatin levels are rising. And the higher the myostatin, all things being equal, the greater your muscle loss, the greater your potential morbidity and your potential mortality. A great example of a person that does not have a lot of myostatin is Eddie Hall, known as the Beast, world's strongest man several times over, held the record for deadlift. And so once again, he had a genetics condition where he naturally doesn't have a lot of myostatin. It's called the Hercules gene. Well, once again, not all of us are born with that benefit of having just abundant muscle potential. So we have to do something about it. We have to watch our obesity. We have to watch our diabetes. We have to watch that metabolic syndrome. And with all the foodstuffs and all the stress of the world, it can become really, really trying. And when our myostatin levels start improving, often our insulin sensitivity improves, and we also reduce our obesity. This is also a great tool for those that are doing a GLP-1, so you're not losing muscle along with the weight that you're losing. There's multiple studies, and there's a much longer presentation I've given on the studies. Probably the most well known is the Berkeley study done by Dr. Evans. So let's go a little deeper. So in a human study, 37 resistance-trained college male athletes, lean body mass significantly improved in patients given the Fortetropin. So they're already starting out in great shape. They're already starting out young. And they were either given 19.8 grams of Fortetropin or 6.6 grams of Fortetropin. And both the 6.6 and the 19.8 grams experienced significant increase of muscle thickness, and Fortetropin decreased the markers of protein breakdown. If you're working hard to build the muscle, you don't want it to break it down. So lots of interesting clinical pearls here from the Journal of American College of Nutrition. Then we get to that famous Berkeley study. They looked at older individuals. So they already have miles on their tires. They already have gone past their 100,000 mile check and warranty. And then the question is, well, what can we do for individuals in that circumstance? They did not change their exercise routine, and they did a randomized, placebo-controlled, double-blind study of 20 participants and found the average muscle protein rate increased by 18%. And how many days? 21 days. Like, wow. So now all of a sudden you're building, and you're giving the body that building the potential to rebuild. And basically, it's like painting a house or rebuilding a deck. Once again, you have to have the ability to engage those processes, but those processes, as we get older, generally slow down. So to be able to pull yourself up from your own proverbial bootstraps and start loading on protein synthesis and therefore increase your chance of having muscle, very great. And that's a powerful study. The hallmarks of aging are very real. We've got mitochondrial dysfunction, muscle atrophy, genomic instability, onwards. And the fact is, we can do things. So epigenetics, diet, and lifestyle. Now you throw on some medications, you throw on some other factors. If you're by a cell phone tower, you live by a golf course, research shows you actually have a higher chance of Parkinson's. Certain things we can control, certain things we can't, but we can control to a large degree being able to load on muscle and, more importantly, maintain your gains. You're an athlete, you're a paramedic, you're a firefighter, well, you want to maintain and stay in great shape. But we all want to stay in great shape. But one day we wake up, and I'm just turning 60 this coming month, and it's like, wow, well, what happened to my really massive forearms? What happened to my ability to curl 70 pounds in each arm? It's like, wow, okay, well, I've kind of been preoccupied. I've been distracted. It's never too late, all things being equal, to basically take charge. And Fortetropin is one of the tools I use with my patients. So Fortetropin, the research is very clear in the 2020 study showing that increase of people 60 to 75, that would be in my category. I want to be able to load on the muscle, and Fortetropin has been shown to help support that natural process with good diet, good lifestyle, and some, of course, exercise. But in the study done by Berkeley and Evans, they didn't change their exercise, and they still had an increase of 18% protein synthesis. So if you have any questions, of course, reach out to Dante. He's my go-to when I place orders for myself, my wife, my family, my patients, and there's a lot of research. I've written an article at NDNR on geriatric syndrome. I wrote one specifically for Male Month on muscles and Fortetropin and male health, but it's not a gender thing. It actually helps male and female alike. It helps all support that natural process. And what we have is that magical spark of life, that fertilization of that egg that makes this a very different product and has never been exposed to heat. So that's the proverbial magic sauce. It's what I use, what I recommend for my vegetarian wife, which does not get enough protein, and what I'm doing to try to regain what I've lost by sitting and helping others. Now it's time to help myself. It's time for you to help yourself. And it's time for you to help your patients gain that upper hand. And if your patients aren't doing GLP-1, they're doing extreme intermittent fasting, they often will not get enough protein, but they also will, as a result, lose muscle. Well, Fortetropin is not your source, ideally, for protein alone. It is the Fortetropin molecule itself, that special sauce, along with additional protein, along with creatine, along with HMB, along with the branched-chain amino acids, particularly leucine. So yes, it delivers some protein, but more importantly, it's a Fortetropin is not replaceable with a general protein. It is something that you have to go ahead and have on board if you have elevated myostatin levels. So that's my approach. It's what I do, and I hope it helps you. Of course, work with your personal provider if you're a consumer, and let's take charge. Let's not worry about falling as we get older and fracturing a hip. let's not worry about those things. But remember, our muscles are producing what? Myokines and exokines. They're hormone-producing tissues that impact a lot of our systems. When I graduated in 1992, we didn't know any of that. Now we do. Our muscles are working for us, whether we realize it or not, and they're also very dense in mitochondria. And mitochondria are our blast furnaces. So you build up the muscle, and if you've done this before, you know it, and you get fit, you get in good shape, you start eating more, but not gaining weight, because those muscles continuously need that energy continuously. So once again, Fortetropin is a tool I use. I'm excited about it, as you can tell, and why not? It's a natural food-based product.